So my name is Isabelle Coonan and I'm from the School of Public Health in UCC. And my research today is based on my master's dissertation, which I submitted in September. And it's called Alcohol-Related Trends in Consumption, Hospitalizations and Deaths in Ireland before the implementation of minimum unit pricing. So this is just the brief outline of what I'm going to cover today. So I'm going to look quickly at the burden of alcohol in Ireland, and then look at my 3 data sources I used, my methods, my results, and then briefly my conclusions and recommendations. So first of all, just a summary that I looked at for the burden of alcohol consumption. So in 2023, there was 9.9 litres per capita of consumption in Ireland. And when you consider the fact that 30% of the population was abstaining from alcohol, this was rising to 14.1 litres per person. And then I looked at just in general at gender and age and hazardous binge drinking from the Healthy Ireland survey in 2022. So you can see that the consumption for men and women is quite similar, but it's more high in men than in women, which was consistent with all my findings. And then you can see that consumption is highest in the younger age group of 15 to 24-year-olds, and also in the older age group of 65 to 74-year-olds. And then for hazardous and binge drinking, again from the Healthy Ireland survey, was showing 22% of those aged 15 plus that consumed alcohol were classed as binge drinkers. And then briefly about minimum unit pricing. So this is part of the Public Health Alcohol Act. It was introduced in January 2022 and sets a minimum price of 10 cents per gram for alcohol. And this aims to prevent the hazardous consumption of the cheapest alcohol, which is in the 15 to 24 group mostly. So my methods then, so I conducted a time trend ecological study over the 31-year period from 1990 to 2021. And I based all of this in Ireland using publicly available data only. My 3 outcomes then were consumption, hospitalizations and deaths. And I did a subgroup analysis for age and gender. And then I used joint point regression for my software because it was the time trend study. So this was able to identify the significant trends and the changes in the patterns. And then my outcome measure was the annual percentage change. So this was able to show the significant changes in the trends. So I had 3 data sources then so I used 2 for each outcome. So I used the HRB data for consumption and hospitalizations. So they're using their data from the nationally and internationally published surveys and literatures. And specifically for consumption, then it was revenue sales figures and CSO population estimates. The GBD data then was used for consumption and deaths. And that was a range of census data, vital registrations, morbidity notifications. And then the HYPE data was specifically the published HYPE reports that were publicly available. And they include the acute public hospital data for discharges and deaths. So these are my results just in brief, and then I think it's easier to talk them through with the graphs. So this is the consumption based on the HRB data. So you can see that from 1990 up to 2001, it is significantly increasing by 2.9% annually. And then when it peaks in 2001, this is 14.1 litres. It starts to decrease then by 1.8%, and that's a significant decrease from there. And I haven't included the graph, but it's the similar for consumption when you break this down by gender as well. You can see it's highest in males, but it is decreasing from about 2001 to 2004. For hospitalizations then, this is based on the HYPE data. So you can see the top line is for it's for males and females of all ages, and this starts in 2010. So it's decreasing first by 1.85%, and then from 2015 on, it starts to increase by about 4.5%. So you can see that you'll see at the end that this is the only one that was increasing, despite everything else decreasing. And then for my death data specifically, this is the global burden of disease, and it's deaths per 100,000 of the population. And this graph includes both males and females, and you can see it increasing again. The increase kind of stops around 2000, and it really starts to go down from there. But it is more varied than the other ones. So there's a lot of change with this. And you can see about 2015, it starts to increase again very slowly by 0.72%. That is a significant increase. But then when the pandemic hit in 2019 to the end of where I collected my data in 2021, you can see there was this really sharp decrease of about 4.10%. So I think you can see how the pandemic affected reporting and kind of how the deaths were reported for alcohol consumption. Just in conclusion then, so you can see that overall there was a decline in consumption and in deaths, and that is quite evident, and there's a slow increase in hospitalizations. I think what I found as well with my research was that all outcomes seem to be slightly linked, and you can link them all to a policy that was implemented around the time. So you can see everything peaking around 2000. You can also see some changes in 2009, 2010, when the Celtic Tiger would have been happening. So you can see that all these things do end up quite linked together. You can see the gender imbalance as well. Now, I know I haven't included those graphs, but I did find that for every outcome was higher in males than it was in females. You could find consumption was highest in the younger age groups and hospitalizations were highest in older age groups, likely a consequence of drinking over time. And the aim of this then was to provide a base for future studies that are examining the impact of minimum unit pricing as the time period for this stopped just before it was introduced. And it could also be used for other alcohol legislations, or even just one of my outcomes was seeing how different policies, different social changes that came in at the time, how they were affected or how they influenced alcohol consumption, hospitalizations and deaths. And just one of my recommendations at the end of my project was potentially for changing the drinking guidelines for the future. I might need to focus on age and gender, or just age rather than specifically gender, because I think it's very evident. I know I didn't include all the graphs, as I said, because of time, but you can kind of see how consumption, hospitalizations and death are higher in males than they are in females each time. So that's my presentation. I just want to thank and acknowledge the work of Dr. Isabelle Coonan, who is my supervisor for my master's dissertation. Thank you.